Hi, this is Dr. Janson, and about a year or two ago, I had a patient that had gotten to the point where I had decided that he really needed to have surgery on a toe problem where the skin was breaking down and ulcerating. He was an older gentleman, over 80 years old. And if you get a foot infection, if the skin breaks down, I used to see patients during my residency that would be in the hospital for like 3 or 4 weeks trying to get rid of the infection in the foot. So, it's a big deal to get a foot infection. It has to be avoided, at all costs. And I'm an orthotic maker. I think I'm one of the last podiatrist orthotic makers in this country. But some patients in some situations do need surgery. So I have a very extended network of different surgical doctors that help me, and they have different ways of addressing different problems, very different ways. So I'll sometimes send the patient to 3 different doctors to make sure the patient, gets along with the doctor, and the doctor will explain the treatment plan, how long will it take to heal. And once in a while, a doctor will come up with like something totally out of the blue that I didn't expect. So that happened to me about a year or 2 ago with this gentleman I was saying had a ulcer on his foot. So he came back, and I actually had the report from the doctor too, and the doctor actually recommended an amputation of the bad toe. So the patient was very shocked, and I was very shocked too. So, but then I was thinking, at first I said, that's ridiculous. How could the doctor have said that? But then I was thinking about it later, and I was thinking, well, taking a toe off is a soft tissue procedure. There's no bone cuts. There's no real healing. It's like healing a cut. It would heal fast. And certainly you wouldn't have an ulcer afterwards. There is no more toe, so the ulcer is cured. So I thought about it. I said, maybe this isn't such a bad idea. I also sent the man to another doctor way out in New Jersey who recommended a more complicated, like real true repair job. And I was there a week ago, and I went with him as an advocate for him to support him. And I was there when he had the surgery, and the surgery was 3 hours. But that's the decision a patient makes. But one way to handle an ulcerated foot, especially toes, is the possibility of an amputation. So since then, I asked patients who were in the same boat to consider an amputation and present it to. Now I have 3 different surgeons that I work with who are amenable to it if the patient likes it, but the patient is very shocked when I say amputation of a toe that's gone bad, because it sounds terrible, who wants to get an amputation, it just sounds terrible. So what we did today was, we had one of the patients who did have an amputation of her toe give us a little testimonial and also some video so you could see what her foot looks like. So I will use this video to send to patients who are considering amputation as a possible way to go. An amputation takes 10 minutes, and the lady in this video, this testimonial, had a very good outcome. So it's something to consider. You could go that way and have an amputation. Unlike the man who decided not to have an amputation last week, but it was a 3-hour-long surgery, and now he has to recuperate from it. It'll probably be a couple of months. He'll be in a surgical shoe, and he has to take painkillers. It'll take 2, 3, maybe 4 months to heal up. It's going to take a long time. Versus the lady in this video, she healed up in 2 weeks flat. She came back to me 2 weeks later. It was all healed up. There was nothing. So let's take a look.
Hello. I understand that you have been feeling some extreme soreness and pain in your foot because of an overlapping toe that has created a situation where your foot becomes infected, the toe becomes infected, very red and very sore, and really impedes walking. Well, I lived through that. In fact, I tried very hard by having shoes made so that they could be higher enough above the sore toe to avoid the problem and perhaps reduce the pain. But it didn't work. Even then, my toe hurt me, and hurt me a lot. And so, with the advice of Dr. Janson, I consulted with an orthopedic surgeon, and we decided, because nothing else seemed to work, that amputation was in order. And I trusted the fact that with the toe being removed, there would be more space, and obviously the danger of the infectious situation would have been removed. So it turned out to be a very easy procedure, much easier than I ever imagined it would be. There was a light anesthesia, very light, enough to put you to sleep so you don't feel it, but you wake up quickly. And when you wake up, maybe there's a little bit of pain, but by the second day, that's gone. And within 2 weeks, the area was healed. And you know what? No toe gone, no more pain. And in fact, I just bought some new shoes that I could wear because the infection had been removed from my body. Don't be scared. I tell you, it's a resounding yes, and it's a situation that you will say to yourself, why didn't I do it earlier?